ESSA Center. Welcome to today's session, Chronic Absenteeism, the Fifth Indicator in ESSA. A few housekeeping items before we get started. Today's webinar is being recorded and links to all webinars will be sent to everyone once they are posted. The session will last for approximately 45 minutes with multiple opportunities to enter questions via the chat function and discuss the implications of the information presented. Everyone is placed on mute, so please do not unmute yourself, but instead refer to the chat function on the upper right-hand side of the screen for questions and comments. And just a side note, please make sure that you address them to everyone so I can help facilitate the question and answer session. Feel free to log your questions throughout the presentation, and we'll leave some time at the end to answer them. If we do not have enough time to get through all of the questions submitted, we will reply to participants via email. Please allow me to share some brief details about today's session. Our presenters are Lexi Barrett and Sue Fothergill. Lexi is the Director of National Education Policy at Jobs for the Future. She develops and implements Jobs for the Future's federal and state education policy agenda, with particular focus on the high school to college transition and policies that increase the post-secondary education and career trajectories of low-income and underprepared students and out-of-school youth. Sue is the Associate Director of Policy Facilitating Attendance Works National Network to Advance State Attendance Policy and Practice, a network of more than 100 organizations from 35 states and the District of Columbia. Sue is also responsible for technical assistance at the local and state level and coordinating Attendance Works policy work at the federal and state level. Before I hand this over to Lexi and Sue, I want to share with you the mission of our National Center. The mission of the Center is to disseminate evidence-based practices and build and facilitate communities of practice to help students attend every day, be engaged in school, and succeed academically so that they graduate high school prepared for college, career, and civic life. And now, Lexi and Sue, I turn it over to you two.
Thank you so much, Amanda, and good afternoon. Welcome to our webinar. This is Sue Fothergill with Attendance Works. And I just want to get us started in grounding us on what chronic absence is and how it's defined. We did have the opportunity to review the questions that you submitted in advance of the webinar, and we will do our best to answer the majority of the questions during the presentation. So with that, I want to share with you the chronic absence and the way we define it, and we, Attendance Works, the Everyone Graduate Center, the National Center for Attendance, Student Engagement, and Early Warning Systems, we're really looking at an early warning measure of students who miss 10% or more of their days on roll for any reason. So we're focused on lost instructional time, whether that lost instructional time is due to excused absences, unexcused absences, or suspensions. When students miss 10% or more of their days on roll, or 2 or more days a month, the cumulative impact often puts them behind academically, which I'll share with you more in just a moment. What's also important to note is the difference between chronic absence, average daily attendance, and truancy. Chronic absence, while measuring all lost instructional time, is different than truancy, which only measures unexcused absences, or different than average daily attendance, which is measuring how many students show up on average any given day. An average measure of attendance across a student population cannot tell you which individual students are missing so much school that it could impede their academic success. We also think it's important to note that chronic absence is something that happens over time. And so we choose to use the 10% measure, which allows us to measure which students are chronically absent at any point in the year. So what we know is that oftentimes systems in the past have been set up to monitor just unexcused absences, or some systems have been set up to create alerts when students are missing several days in a row consecutively. And so it's a shift in thinking to help schools and school districts to monitor lost instructional time, even if those lost days are sporadic and happen over a period of months. What we also know is that parents aren't always monitoring or tracking attendance absence days over a period of time and can sometimes lose track of the number of days that their children have missed throughout the year. And so having systems set up that allow us to pull the data to monitor which children are missing 2 or more days a month can help to facilitate early warning and earlier communication with parents. The academic impact is pronounced when students are chronically absent. We've seen multiple sources of information and research from across the country with repeated finding and outcomes that demonstrate that when students miss too much school, they're off track to academic success, beginning as early as pre-kindergarten. What you're looking at here is a group of second graders in Chicago and their reading Dibble scores. And you'll notice with the stair-step pattern down, each additional year of chronic absence resulted in a reduction in academic proficiency in second grade for reading, with the students on the right having the greatest need for intervention and having had the most repeated patterns of chronic absence. We also know for older youth that chronic absence can impede academic outcomes. And what you're looking at here is a group of students in Baltimore in 9th grade and the relationship between their attendance and the number of courses that they passed in their 9th grade year, with the students with the highest rate of attendance having passed all of their courses, and then each line down shows a decreasing rate of attendance and more courses failed. We also know that on-time 9th grade promotion is a predictor of high school graduation, and so students can fall off track academically as early as their freshman year in high school if they're not consistent attenders. So we know from the research that chronic absence demonstrates whether or not students can be successful in school as early as pre-kindergarten. When children are chronically absent in pre-kindergarten, they enter kindergarten less ready to learn. When young people are chronically absent, kindergarten through second grade, there's a direct relationship to the important third grade milestone of being able to read on grade level. And then when students are chronically absent in middle or high school, there's a direct relationship to whether or not they will graduate. And with that, I'm going to, I did want to also share with you and begin to introduce some of what we understand about why students miss too much school. It's important to understand that chronic absence is a complicated issue with many drivers that can contribute to why students miss too much school. What we do know from research is that there are 4 buckets of which the drivers fall into. One of them is simply misunderstandings about the relationship between attendance in the early grades and academic outcomes, or families and students misunderstanding the academic impact of missing school over time. We also know that some of our students face significant barriers to getting to school, whether those barriers are unmanaged chronic illnesses or lack of a safe passageway to school. Then there are issues such as aversion and disengagement, where students can experience aversion to school related to unsafe school environments, struggling academically or socially, situations of bullying, or situations of ineffective and exclusionary school discipline. We also know that students can become disengaged from school and over time attend less often, furthering the disengagement. And oftentimes contributing factors could include a lack of a relevant or meaningful relationship within the building, being vulnerable to external forces that encourage students to miss school, or poor school climate. Ultimately, while all of these factors can contribute to students being chronically absent, the important thing for schools and school communities to seek to understand is which of these drivers are most prevalent for a particular school or a school community that's seeking to reduce chronic absence. Some schools may be experiencing just a few of these factors, while other schools or school districts may experience many more. And so we encourage schools and school districts to explore their data, identify from a qualitative perspective what are the issues, and use the quantitative data to understand the scale and the scope. And with that, I will turn it over to Lexi.
Great, thanks so much, Sue. So I'm going to talk a little bit about the Every Student Succeeds Act and an opportunity with this law for states to address chronic absence. So the Every Student Succeeds Act was signed into law in December 2015. This law is often known by the shorthand ESSA or ESSA. ESSA is the latest update to the Elementary and Secondary Education Act, which was first enacted in 1965 as the main source of federal support for our nation's K-12 schools. The Elementary and Secondary Education Act has been updated many times over the last several decades, including through the No Child Left Behind Act in 2001, and most recently ESSA in 2015. The law provides details on a number of different federal funding programs that K-12 schools can access, and it also outlines details for how states that receive Title I funding must develop plans that, among other requirements, describe a statewide accountability system. Under ESSA, state accountability plans have to include 4 academic indicators. All schools must count proficiency on math and English language arts tests and progress in achieving English language proficiency. High schools must also count their graduation rates, and elementary and middle schools must use one other academic indicator, which could be student growth. So as we look at the next slide, so if you could advance, what's new in ESSA compared to No Child Left Behind is that ESSA also requires that states include an indicator of school quality or student success in addition to the 4 academic indicators that I just discussed. This indicator has come to be commonly referred to as the 5th indicator. In the law, this is defined as you see on the slide here. And the law explicitly says that for all public schools in the state, not less than 1 indicator of school quality or student success must be included in the state accountability system. And it provides some parameters and requirements around which states should think about what indicators to use. This includes allowing for meaningful differentiation in school performance, an indicator that is valid, reliable, comparable, and statewide, with the same indicator or indicators used for each grade span, and an indicator that may include one of the following measures as enumerated in ESSA. And that could be things like student engagement, educator engagement, student access to advanced coursework, school climate and safety, or any other indicator the state chooses that meets the requirement. These are the parameters that the law defines for the 5th indicator. States can choose any indicator or multiple indicators that meet these requirements. So how does chronic absence measure up? On this slide, you can see that we've broken out the requirements in the law, and as I just read to you, the law requires that the indicator of school quality or student success must be able to first meaningfully differentiate school performance, and we know that chronic absence is able to do this. Next, the indicator must be both valid and reliable. In shorthand, if you're not familiar with these terms, you can think of validity as the degree to which an indicator measures what you are trying to measure, and reliability as the degree to which you will get the same answer when you ask a question or try to measure something multiple times. Based on the research and experience with chronic absence, we know that chronic absence meets both of these requirements as well. And finally, the indicator used for a state's 5th indicator must be able to be measured statewide and also calculated separately for each student subgroup. We know, based on state experiences, that states are able to use chronic absence to serve both of these requirements as well. So based on this analysis, we can see that chronic absence is a good option for states to consider as they are developing their new accountability system and writing their state plan under ESSA. So with that, I will turn it back over to Sue to talk a little bit about how states might think about the information they gain from looking at chronic absence if they do decide to use this as an indicator of school quality under ESSA.
Thank you, Lexi. So some of the questions we received had to do with how do schools or school districts work to achieve reductions in chronic absence, and what are the strategies? And so I want to share with you frameworks that we've developed over time based on the evidence of success of schools and school districts that are working to make a difference. So I'll start at the systems level strategy and then drill down to the school level approach. So when we've seen school districts dramatically reduce chronic absence across their system, we see that they're actively engaged in working in all 5 of these areas of positive engagement, shared accountability, strategic partnerships, capacity building, and actionable data. So beginning with actionable data, it's essential that school districts or states equip schools with the information that they need to be able to make decisions about chronic absence and focus their efforts. In particular, schools need access to school-level data, grade-level data, and student subgroup data along with information about individual students. It is possible for states or school districts to help to create reports that school leadership can easily pull down from a student information system, or in some of our most successful districts, we've seen those districts actually push the data, the reports out regularly to ensure attention to the information. Capacity building for school administrators and their staff is essential as we shift from a frame of truancy or more punitive responses to absenteeism to a more holistic tiered intervention system that utilizes chronic absence data as one measure of an early warning system to respond to the needs of students and their families. Strategic partnerships can be essential in schools or school districts that are experiencing higher levels of chronic absence, and utilizing the data to better understand ways in which schools or school districts can partner with other community agencies and other community-based support. And an example of a strategic partnership that was highly successful recently includes New Britain, Connecticut, when they discovered that younger students were having difficulty getting to school after major weather events in the winter, as passageways weren't always cleared and therefore inhibited students' easy and safe access to school. In response to that information, the following winter, the school district partnered with their public works agency to ensure that certain pathways were cleared, and those pathways were communicated to families so that they knew which way to take to school so their kids could get to school safely. Shared accountability is important from the perspective of everyone understanding that chronic absence is a measure that they can collectively take action on, whether the accountability rests at the school level, within the district that's supporting the schools, or the other public agencies or community-based partners. Being clear on the opportunity to work in partnership around the issue of chronic absence and the role that different partners and community-based agencies can play in making a difference is essential to the work. And finally, positive engagement, ensuring that we're educating and raising awareness with our families and students about the impact of absenteeism, and ensuring that we're approaching this work from a relational perspective where we are working with families to problem solve and diagnose the challenges that are happening that are contributing to absenteeism. Drilling down to the school level, we encourage schools to take a tiered intervention approach, much like a public health model, in reducing chronic absence for their buildings, starting with prevention strategies first, and then scaling up into specific interventions for students or student subpopulations, intensifying resources and supports as necessary. We know that schools make a difference with chronic absence when they invest in prevention-oriented strategies focusing on these 5 site-based recommended strategies, engaging students and families and raising awareness about the importance of attendance, ensuring that they have accurate information about attendance expectations, and resources supports in schools that can help them if they're struggling with a barrier. Ensuring that we're recognizing and noticing not just perfect attendance, but also good and an improved attendance. For students that they struggle to get to perfect attendance, being acknowledged for improvements or showing up almost every day can really help to create a culture of attendance. We have to monitor our attendance data and practice, and generally we encourage that this happens within a school team in a building where the team is organizing the school's attendance strategy. In the past, when we focused just on truancy data, oftentimes the responsibility for focusing on attendance may have fallen to 1 or 2 people within the building, following up on unexcused absences. As we shift to a more holistic tiered intervention strategy, we encourage that a team and an existing team, if there's a multi-tiered systems team or an instructional leadership team, or even an attendance team that's a subcommittee of an existing group of adults, help to organize the overall attendance strategy and engage the entire school community in implementation. We know that personalized early outreach makes a difference, especially for our students that are at risk for chronic absence or more likely to miss school, ensuring that we're following up on each individual absence with a personalized phone call home to find out what's going on and to let the family know and the student know that they were missed that day. And finally, developing programmatic responses to barriers. And what we mean by that is if you think about your tiered intervention system, beginning with prevention, really once a school dives into their data and begins to understand the contributing factors for chronic absence, schools can take action on prevention strategies that can help to reduce the barriers to chronic absenteeism. And an example of an effort like that is across the country, Whirlpool has been partnering with schools to help to install washer and dryers in buildings to help families be able to keep their child's school uniforms clean so that they can attend school, as dirty uniforms had been identified as a contributing factor to why students were missing school. So rather than dealing with the situation of unclean uniforms on an individual student basis, the schools and Whirlpool identified a prevention strategy that removes a barrier. And so as schools dive into the data, utilize the data to understand which kids are missing school, they can then hold focus groups or conduct surveys or otherwise just sit down and talk with families to better understand what the barriers are for their particular families that are struggling with attendance. We use the 10% definition to promote an early warning response. We can begin at the start of the school year and noticing which students are already starting the school year off with absenteeism. Research has shown that when students miss 2 to 4 days of school, 2 to 3 days in the first month of school, that they are 50% more likely to be chronically absent by the end of the year. And when students miss 4 days of school in the first month, they're 90% more likely to be chronically absent by the end of the year. So we don't have to wait until the days add up. We can respond as soon as we see a problem. Some of the possible tier 2 interventions that we've seen utilized across the country include the Success Mentor strategy and assigning a caring adult or older peer to partner with a chronically absent student, partnering with families and students to create plans to address barriers to attendance, recruiting students for engaging before or after school activities, helping to address transportation barriers, and then ensuring that unmitigated health-related barriers are not a cause of absenteeism by working with families and school nurses and other medical healthcare providers to address health-related barriers to attendance. With that, I will turn it over to Amanda to help to facilitate our Q&A.
Thank you, Sue and Lexi. At this time, I don't see any questions in the actual chat function. So during this time, if anybody wants to ask any questions or pose any thoughts, please do. But we did, prior to, have a few questions submitted that we're going to go ahead and ask as we wait for everyone else. Sue, I think this question might be best suited for you. So Lexi, please feel free to weigh in. What are suggestions for state education agencies to help shape the definition of chronic absenteeism, or on the flip side, what is attendance, for local education agencies to better accurately capture this data element? For an example, some LEAs count attendance in homeroom as present for all day, and some use half day, et cetera.
Thank you, Lexi. Thank you, Amanda. That's an important question. As state education agencies make the decision to include chronic absence in their ESSA plans, it will be important for states to establish definitions. One thing that we've seen as a best practice is collecting attendance data by period for secondary schools, for middle and high. So not just counting attendance in the homeroom, as the person submitted the question pointed out, because oftentimes what we have seen, and we're all familiar with this, where some of our students may make it to homeroom but aren't necessarily present for all their classes. And so an example of a definition that can help to address this is the state of Maryland has a definition where if a student is present 4 or more hours of the school day, then they're present the full day. If they're present 2 to 4 hours, they're present half the day. And if they're present for less than 2 hours, then they were absent for the day. And having a state definition that helps to differentiate between whole and half day can ensure that when schools are capturing the data for students, especially if they're doing period attendance for older youth, we can begin to determine the extent to which students are showing up for school, but perhaps are not showing up for class. And just as an aside, as an example of why this could be really valuable, having worked with a high school that started to look at period attendance as a contributing factor to chronic absence, they were able to notice that certain students were attending certain classes very regularly and then missing very regularly other classes. And so then they had the type of information they really needed to connect with those students to better understand if they were missing particular classes because they had fallen behind academically and started cutting because they were lost in that particular instructional program, or also they began to explore whether particular teachers had better classroom management or better classroom climate. And so utilizing the data in a way that really allows us to get a close-up analysis of what are the contributing factors and which classes students are missing in secondary school can help to paint a more robust picture of what the interventions might need to be.
Perfect. Thank you, Sue. Lexi, this next question I think is geared more towards you. How can I get my state to use this indicator in the ESSA plan?
That's a really great question. So states right now and for the past several months have been in the process of developing their ESSA plans and are doing a good amount of public comment, engagement with stakeholders, including teachers and school districts and others. And that's a really great opportunity to have conversations, to weigh in about different indicators that the state might be considering in its accountability system. And there are some states that have already submitted those applications to those plans to the Department of Education for review, but many states have not yet and are still in the process of developing and considering those plans. So it's a really great opportunity to look to right now to have those conversations with your state education agency. And in terms of how to engage in that process, would recommend looking at your state education agency's website, even just Googling ESSA to find the best way to start that conversation and to engage with your state.
Perfect. Thank you, Lexi. The next question is, how can we support local education agencies to feel this is an indicator that is reliable, measurable, and something they can impact?
Thank you, Amanda. You know, it's interesting. Dr. Belfont actually said on a webinar yesterday that this is one of the most often repeated analyses that then results in the same outcome, which is that when students are chronically absent, they fall behind academically, pre-K through 12th grade. And so there has been multitudes of studies done by Everyone Graduate Center, Johns Hopkins University, AttendanceWorks, and other education research consortiums and university partners all across the country that have conducted a variety of different types of analysis of chronic absence, whether it's the impact of chronic absence on social and emotional learning in pre-K, the impact of chronic absence in middle school, the impact of chronic absence in kindergarten and third grade reading outcomes. There are just so many studies that everyone on this call could refer to help to make the case at the local level of the impact of absenteeism. We certainly have those collected on our website under a research tab and by subject area, including analysis of the types of activities that actually make a difference in reducing chronic absence, such as engaging after school opportunity. The other thing I would encourage folks on this call to do is to conduct the analysis locally. While the research exists across the country, it is always the strongest case can always be made locally with local data. And so to the extent possible, if you can use your data to do an analysis, even if it's just looking at third grade reading and high school graduation and running the numbers against students who are chronically absent versus not chronically absent, you will be able to make the case at a local level, along with relying on on access to national research.
Wonderful. Thank you, Sue. Another question is, how can we make schools aware of the significance of chronic absenteeism as it relates to academics, which I think you kind of touched on a little bit, but anything you can expand on?
I definitely think it goes back to using your local data, and I offer the best practices that I have seen. It really are school superintendents or chief academic officers using the local analysis at some type of convening with principals and school staff to share the information. It's most powerful if you can show your principals or your school administrators or at the state level, your superintendents across the state, the difference it makes when students are in school every day. And I think that common sense, and we all as educators and education advocates recognize that when kids are in school, they're more likely to succeed. I think that the eye-opener is utilizing this particular measure as an early warning indicator to tell us which students are off track. Oftentimes in the past, we've focused a lot on average daily attendance or truancy, and both of those data points, while useful for a variety of reasons, will not identify all the kids who are off track to successful academic outcomes, especially younger children who are less likely to be truant, but more likely to miss school and have excused notes that accompany those absences. And so that's why it becomes so important to run the data and use that local information to make the case.
Thank you. Another great question that's come through is, we have a good handle on identifying and intervening with students from K through 8, but interventions drop significantly at the high school level where the numbers become overwhelming. Is there any way to best prioritize this for high school students?
I think it can become overwhelming, and so one of the things that we didn't show in this set of slides, but I think is important to understand, is that in K-12 systems, we often see the highest rates of absenteeism in the early grades, in pre-K and K, in first grade. It begins to get better in first grade. And then generally attendance improves over time until students reach high school. And then we start to see higher rates of chronic absenteeism, and in some communities, extraordinarily high rates of chronic absence. And so high schools are dealing with a disproportionate number of students who are missing too much school. So I think it's a valid question. The answer becomes complicated because it really does require a more nuanced analysis of your data, utilizing the early warning indicators of suspension, attendance, and behavior, and starting to triage your students and bucket them out based on the data, and then also based on the understanding of what's happening that contributes to their absenteeism. And so, for example, in Baltimore, the community where I live, we actually had to differentiate between severely chronically absent students and chronically absent students because we had so many students. Over 50% of our high school students were qualified at that 10% benchmark. So then we needed to understand for that population of half of our high school students, was there a difference? And we found that we had a number of students that were actually missing 20% or more of their days. And then we had to do a further analysis, and we found that many of the students that fell into the 20% or more of their days on roll being absent, these were also our overaged and undercredited students. And so they needed a unique set of interventions, sometimes requiring alternative placement, flexible scheduling, and additional supports and services. Some of them needed child care services. Some of them needed additional interventions based on just being so far behind academically and needing the ability to do sort of a quicker pace towards their high school diploma. And so I would argue that it's complicated at the high school level, and it does require a deep analysis of the data and really exploring the information both from a quantitative perspective, you know, how many kids, what percent of kids, what grades, and differentiating between your kids to ensure that you're providing the right supports. I will also offer that it's essential at the high school level, although it's essential K-12, to ensure that the climate and culture of your high schools are a place where are inviting to high school students. They're warm and welcoming. When students approach the building, they're invited in a warm and friendly way, and that they know that there are adults in the building that are there for them to support them in their success in reaching graduation. And so school climate can make a significant difference in how engaged and supported our young people feel. And since high school students do have the ability to opt out in ways that younger students don't, it really is about building that relationship with our high school students and ensuring that they know we care about them.
So as a great follow-up to everything you just said, Sue, the next question we have received is, what can we do for those students who are heading to truancy who have always had a history of absenteeism? And I think you kind of talked about that a little bit in the Baltimore example, but is there maybe some other tactics that you're aware of as well?
I think that it definitely builds on what I offered in just a moment ago, but I would add that for some of our young people with, years of chronic absenteeism or truancy, that additional support and perhaps Tier 3 leveled interventions where we're really looking at case management, interagency support may become necessary depending on what the issues are that a student is experiencing that contributes to the fact that they have a history of absenteeism and truancy. The most important thing we can do is ensure that we fully understand what has been going on for the years in which the student was chronically absent. And so any intervention that is put in place has to be fully informed by that young person sharing their story and advocating for what they need to be successful, and then ensuring that the coordinated interagency response is in concert with what we understand from the student about their needs.
Wonderful, thank you, Sue. And then the last question I had that was submitted prior to the session was, school RNs provide a critical link between health and learning. How can they be better utilized to improve attendance?
That's an excellent question. And so we absolutely think as we look at this tiered intervention model that nurses, school nurses, and the health community at large are essential in helping to create a prevention and intervention-oriented approach to reducing chronic absence. As we talked about earlier, chronic absence includes excused absences. And for a long time in our country, what we're really talking about is a culture shift from only focusing on unexcused absences, which is where we've been for a long time, to really focusing on any type of lost instructional time. And so oftentimes young people and their parents think that as long as we turn a note in, or as long as we have that doctor's note, then that makes it okay. And what we know from the data and the research is that the academic impact is profound, whether those are 20 or 30 excused absences or 20 to 30 unexcused absences. The outcome for the young person is the same. They're going to fall behind. And so this shift in dialogue around what is an appropriate absence and when is it okay to be absent versus when students need to be in school, it's essential that we involve our health community and our school nurses, because we're educating families and students about this shift, and school nurses have credibility about the issues related to health. And when students can stay home, when they're too sick to come to school, and when it's okay to send a 5-year-old with a runny nose to school, or if a family is really struggling around issues of health, physical or behavioral health that are keeping their kids out of school, having the school nurse as part of that conversation to ensure that families feel supported and have access to health resources, it can be essential. Also, I would just add that analyzing chronic absence data and utilizing information related to issues like asthma, vision, dental, these are all primary reasons why kids miss school, because they have undiagnosed or unmanaged vision-related issues, or they have dental issues that are keeping them out of school that haven't been addressed. Or if a child is experiencing asthma and has an unmanaged asthma issue. We can address those individually, but it also becomes important to understand when those types of barriers are barriers for a significant number of children, and involving our healthcare community and helping us to think through prevention strategies that help to address larger populations of kids, such as vision screening in school, such as implementing programs and education and awareness for asthma-related barriers, and also ensuring that students have a medical home, and ensuring that students have a dentist that they see regularly. So I would offer that healthcare professionals play a role in education and awareness and helping to establish relationships and access to resources, helping us to think through the health-related prevention strategies that can be put in place at a school or community level, and then also really working with individual families that have health-related barriers.
Awesome. Thank you, Sue. I see that we don't have any other questions in our chat function, so I guess we'll give everybody a few moments back of their afternoon. Thank you, everyone, so much for attending today. We hope you found it helpful and informative, and we invite you to attend upcoming events. You'll see on the slide on the screen. We have two coming up just very soon, actually, and so please follow those links for registration, also for resources, and then feel free to email that info@nationalstudentsuccesscenter.org email address to sign up so you can stay aware of, be on the email list and everything, and stay aware of events beyond April. Just as a reminder, all of these sessions are being recorded and will be sent out in a follow-up email. And at the end of the session, we are asking, there will be a survey that will pop up. We're asking everybody to please consider participating so that we can use that information for future sessions. Hope everybody has a great afternoon, and thanks again for attending. We appreciate it.